So we're going to cover respiration on everything we covered November 4th, 2015. Let's start off with what we can see on the outside, or what can we point out on the outside. You have 4 sinuses. 3 of them you can see on the outside. You have a maxillary sinus, which is in this area, a ethmoidal sinus here, a frontal sinus up here, which you can see right there. Those are all paired. The 4th sinus is the sphenoid sinus, which is in here. Now, moving on, what else is on the outside? You have this nasal vestibule, which is right here on the outside, and that it consists of stratified squamous epithelium. That's non-keratinized stratified squamous epithelium, which enters into the nasal cavity. The nasal cavity consists of pseudostratified ciliated columnar epithelium with goblet cells. Along with the nasal cavity is the nasopharynx that consists of pseudostratified ciliated columnar epithelium with goblet cells, as well as the trachea, which is down here, and your bronchi, which we're going to get into here shortly. After this nasal cavity, you have a nasal pharynx, oropharynx, laryngeal pharynx. Now, part of the nasal pharynx, you have a pharyngeal tonsil. If you go down, you have a palatine tonsil. You have a lingual tonsil. Now let's go back to this area here, which is the oral cavity. The oral cavity also consists of non-keratinized stratified squamous epithelium. This is the tongue. This is the hard palate. This is the soft palate. This is the uvula, or uvula, however you want to pronounce it. We're going to keep on going down past the lingual tonsil, and this area here becomes the laryngopharynx. This part right here is the epiglottis, which covers and prevents food from entering the larynx, which is this area here, and lets food go down this back area called the esophagus. Below the larynx, now you have the trachea. This is the hyoid bone. This is the thyroid cartilage. These are the cricoid cartilage. So here you continue down the trachea. Right here where it splits, it's called the carina, and that's a piece of cartilage actually, and it's a good identifying spot. Now you have bronchus, or bronchi, which are these blue ones. This is for your right side. Your right lung is for your left lung. These first trunks are considered your primary or main bronchus. These ones that split from it are considered your secondary or lobar bronchus. And these tertiary ones are your tertiary or segmental bronchus. From there, you have something called a terminal terminal bronchial. And the reason you know it's a terminal bronchial is after that you get into a respiratory bronchial. Respiratory bronchials have alveolar sacs connected to them. The alveolar sacs consist of alveolus, and then you have alveolar ducts. The alveolar ducts have the simple cubital epithelium. Alveolar ducts consist of simple cuboidal epithelium, and alveoli consist of simple squamous epithelium. Alveoli, simple squamous epithelium. Alveolar ducts, cubital epithelium.
And alveolus are the functional unit of the lung.
Alveolus are the functional unit of the lungs. Now, along with the lungs, the way you can tell the left one from the right one are a few different things. First off, this one doesn't show it too well, but you can see the one in the left lung, this primary bronchus is a little bit more horizontal, and the one on the right is a little bit more vertical. Another thing separating them, I'm going to show you the lung now. You have 2 fissures on the right lung. You have this big vertical or horizontal one, and you have one on the side that's oblique. That gives, so first off, it has two fissures, and those two fissures split into the superior, middle, upper, middle, and lower lobes. On your left lung, you have only one fissure, one oblique fissure, in separation to the upper and lower lobes. Now, cover the lungs. Now, other things to consider with the lungs, you have the apical, which is the top of the lung, and the basal, which is considered the bottom of the lungs. The lungs sit in a pleural cavity, and the lining on the inside of the pleural cavity is the parietal pleura, and the lining of the actual lungs is the visceral pleura. Now you have various muscles that come into inhalation and exhalation. For inhalation, it's the sternocleidomastoid, the scalenes, the external intercostal muscles, and the diaphragm. And that's for inhalation. For exhalation, it's your internal intercostal muscles and your abdominal muscles. It's your abdominal muscles and your internal intercostal muscles for exhalation.